to your brain. Your brain is the greatest and or most important or most powerful weapon God has given us. Now, vascular dementia is about the brain. Why? Vascular dementia is a decline in thinking skills caused by conditions that block or reduce blood flow to various regions of the brain, depriving them of oxygen and nutrients. It's very simple here. It's a decline in thinking skills, the thinking skills caused by the conditions or a situation that block or reduce blood flow to various regions of the brain. It means that the brain got regions, right? It is a general term that describes problems with reasoning, how we reason, planning, judgment, memory, and other thought processes caused by brain damage from impaired blood flow to your brain. In short, it's inadequate or not enough blood flow that can really damage and eventually kill your brain cells. In general, if your organs in your body, the organs don't have enough supply of blood, then of course these organs can't function well. The human body is made up of over 100 trillion cells, and every cell actually needs some blood and with oxygen and nutrients. And if these organs, especially the brain, which is the upper part of the body, is a real challenge for your heart to even pump well to get blood to your brain. But if in a situation that your arteries, that the blood vessels are plugging and reducing blood flow or impairment of blood flow to the brain, then of course the brain cells will suffer. And if your brain cells suffer, that's where we have this vascular dementia setting in. In vascular dementia, changes in thinking skills sometimes occur suddenly after a stroke, which blocked major blood vessels in the brain. Normally, it's about 5-6 minutes only. If the brain doesn't have enough blood, about 5 minutes, enough blood, 5 minutes, then there's a problem. Thinking difficulties may also begin as a mild changes that gradually it gets worse, and as a result of multiple minor strokes. And even we have what are called unknown strokes or invisible strokes. You see, when you go to the hospital, maybe somebody may experience mini stroke, or what they call a mild stroke. But beside it, we have what they call invisible strokes or unknown strokes. So it means that even the person or the doctors even have no idea that even strokes have occurred in that person. And if you have unknown strokes happening to you, to your brain, then of course this can finally or eventually lead to vascular dementia. You see, we have a condition also called atrial fibrillation. Atrial fibrillation is simply what? You see, when it's about a heart disorder. Now, you see, the heart has 4 chambers, the 2 upper chambers and the 2 down chambers. Now, naturally, the upper chamber should beat in harmony, in unison or in harmony with the lower chambers. In atrial fibrillation, there's a disharmony of the upper heart chambers not beating in harmony with the lower chambers. So when this happens, there's a shortage of blood, or the capacity of blood flowing in the body reduces. And if it reduces, then there's a real challenge for blood to get to the brain, because the head is above the heart. So even if everything is right, normally it's a real challenge for your heart to pump enough blood to your brain. So if there's a heart condition, then even there's a bigger challenge. And if the arteries are plugging, then even that is even the worst condition that can happen. When we move on, we see that there are some other conditions like what we call Ischemic stroke. Ischemic stroke is that when there's a reduction of blood due to plugging in your arteries. And then we have what they call the hemorrhage stroke. That when there's an aneurysm. An aneurysm is sort of a bulge in the artery wall. The tiny arteries directly supplying blood to the brain. The inside the walls of these arteries there could be an aneurysm, like a balloon that can damage and then leak blood within the head, and that is very, very serious condition. Now, let's come to the symptoms of vascular dementia. How would you know that you have vascular dementia? But well, before then, let me put the number on the platform. You may not have vascular dementia, but you may have a different health problems. Whatever the problem, just give me a call. This number is also WhatsApp number, so you can call me and discuss the problem with me, and by God's grace, we can take it from there. Now, the number is +44, calling from the UK. It's +44 738 464 7300. The number again, +44 738 464 7300. The second number is +44 745 988 9152. The number again, +44 745 988 9152. Now let's come to the symptoms of vascular dementia. Now, the symptoms of vascular dementia depend on which part of the brain is affected, and the severity of symptoms depend on how long the brain was without oxygen and blood. Once again, the severity of symptoms depend on how long the brain was without oxygen and blood with nutrients. And it all depends on the region of the brain. Now, the first symptom is confusion and memory problem. Normally, you see that you may be a person that you say, 5 years ago, I used to remember a lot of things, but now I can't remember much. I'm losing my memory. If you're losing your memory, it's not just by accident. Something is happening to your brain cells. Possibly your brain cells are dying more quickly than they should be, replenished. Naturally, the brain gets smaller with age. It shrinks with age. But you see, if you feed the brain with oxygen and nutrients, the shrinkage process can be delayed by 20, 30 years. It's highly possible. But then if you don't have a good circulation that can transport oxygen and nutrients to your brain, then of course there will be a problem. The brain shrinkage can be very, very fast. So the memory problem and confusion is a typical symptom. The next symptom is trouble paying attention, that you don't have focus. You can't focus. You can't concentrate. And then there's a reduction of ability to organize your thoughts and action. You have a plan, but you can't plan. You can't organize that. There's a decline in ability to analyze a situation or develop an effective plan and communicate with that plan to other people. Another symptom is difficulty in deciding what to do next. You may have some thought. You may come to a point, but you don't know what to do next. You are confused. And then, of course, that individual may feel restless and agitated and upset sometimes. That the person may also have an unsteady gait. If you say unsteady gait, it means a loss of balance. In your walking, you may feel that you can't walk properly. You're moving forward, you feel that you're moving to the other side. You're moving forward, you're moving sideways. So there's a loss of balance or loss of coordination. There's also a frequent or sudden frequent urge to urinate or to pass urine. And then if you're not careful, you may lose the ability to control your urine. So that individual, when you feel the urge to urinate, if you're not careful, you could urinate on yourself. I mean, so to speak. That individual may also experience depression or apathy. You'll be there and you don't even understand why you are depressed or you feel sad. There will be that sort of sad feeling within you and you don't even understand. So individual, you cannot have that swing mood, that the swing mood. You can't have that, of course. So this means that the brain, there's a disorder starting in your brain. That person may have trouble speaking sometimes or even understanding speech. That person may have also difficulty even pronouncing a specific word. Maybe a word that he used to be able to pronounce, but he has problem to pronounce that word. He may make effort to pronounce it, and the person has difficulty pronouncing that word. So these are the common symptoms of vascular dementia. But now let's look at the stages of dementia. It doesn't just go come to a very severe stage. No, it starts bit by bit. We have 7 stages of vascular dementia, 7 stages. The first stage, listeners, is stage 1. Here at stage 1, there's no impairment at all. The patient has no problems at all. But don't wait until you get symptoms before you feel that you have a disease or you feel unwell, listeners. But because stage 1 doesn't show anything. You see, that is the evidence that diseases got stages. It starts somewhere, you have no symptoms at all, but then it keeps developing. It keeps developing. Stage 2 of vascular dementia is questionable impairment. The patient begins to have some difficulty, but still can function independently, can be independent, but has some small difficulty. Stage 3 is the mild impairment. The patient has it's obvious. It begins to be obvious. It begins to be clear. It's now begin to be clear to other people that this guy has a problem. That is stage 3. Stage 4, that is moderate impairment. Here, the patient needs help with caring for him or her. So the person cannot be on his own or her own. That is stage 4. So the person cannot carry out daily activities. And that's very sad. Stage 5, this is moderate to severe impairment. So this person still, of course, needs more care. Stage 6 is severe impairment. Here patients are unable to function independently. They are unable, so they are dependent solely on carers. That is one of the reasons why abroad here, especially the UK and the US, there are a lot of care homes. Alzheimer's is sweeping, actually, the Western world. And the stage 7 is very severe impairment. Here, there's a body and mental function begin to fail. The body, mental function begin to fail. That is at this stage 7. So you see, it's a clear evidence that diseases do not start in the blood. It starts in your cells. If your cells are not functioning well, especially in the brain, that's where you begin to have a problem. It's bit by bit. It starts somewhere, and then it gets somewhere to the final stage. It takes years and years. I'm not trying to just scare you, no. But I want you to be aware that nothing just happens. Everything has a starting point. So the causes of vascular dementia is simply an impairment of blood to the brain. The brain doesn't have enough blood with nutrients and oxygen to your brain. So the brain cells start to be starved, and they are starved. They don't get the nutrients, so start dying very quickly. And such an individual may also have a shrinking of the brain so quickly. It can be quicker than or faster than it should be. It's really surprising that individuals have smaller brain than they used to have, and they have no idea because the brain is not receiving enough oxygen with nutrients. So another cause of vascular dementia is that stroke, that is infarction, blocking of blood to the brain, as I've told you about. And then another situation is the atrial fibrillation, that if you have a heart disorder, those individuals that experience palpitation, if you have palpitation, know that your heart is not pumping enough blood around your body, because heart that beats very quickly cannot effectively pump blood throughout the body, but especially the brain wouldn't get enough blood. This is very clear. We have a condition that the arteries, the small arteries, that we call them arterioles, small arteries, the blood vessels that supply blood directly to the brain, they may be chronically damaged because of inflammatory condition that you have no idea. And so if they are damaged and they are narrowed, it can also reduce blood flow to the brain. That is why it's very important, listeners, to detoxify your body, get inflammation down. There are therapies, natural therapies to detoxify yourself, bring inflammation down. If you bring inflammation down, you will be a very, very healthy person. I'm telling you, inflammation is the basis of diseases. And people have even chronic inflammatory condition in their body that they have no idea. And that can cause chronic damage and narrowed blood vessel in the brain. Diabetes is something that we can't just skip at all. There are people that have pre-diabetes. They have no idea. Pre-diabetes and pre-diabetes, research has shown that they cause the same problems as the regular diabetes type 2. One of the complications is plugging the arteries, reducing blood flow in the body. So these are the causes here. But risk factors, if I say risk factors, who gets these vascular dementia? Remember, people in the 30s, 40s, 50s, it starts there because we mentioned 7 stages. So the stage 1, 2, 3 could start in the 30s, 40s, and without you knowing anything. A patient came to the office. She was just 18 years old with atherosclerosis. It means plugging of the arteries. Her arteries were plugged. And do you know how to realize that your arteries are plugged? You walk by the stairs or climb a hill and you feel tired easily. You see that the so-called numbness, tingling on your fingers. You can experience that. You can feel that maybe something is moving in your brain. Some kind of sensation in your brain. That can also be that you don't have enough blood. There's nothing that can get into your brain. Some individuals may say, doctor, I feel that there's some sort of something, some animal or some organism is moving in my brain. Nothing can break the blood-brain barrier. In fact, it's very difficult for some sort of organism to get into your brain. So nothing can get there. But if you have some sensation in your brain, then it means that you don't have enough blood flowing in your brain. Sometimes you have unnecessary headaches. Sometimes you have maybe part of your head, you have some sensations. It all means that you might not have enough blood flowing into the brain. Don't underestimate it at all. So it's not about vascular dementia is not for higher age at all, because we have 7 stages of vascular dementia. It can start in the 30s, in the 40s, and then maybe the 4th stage that it appears in the 50s or 60s. And it's very unfortunate. Another risk factor is the history of heart attack and stroke. If you've ever had stroke before or heart attack before, remember, Any individual that has had a heart attack, your heart will never be the same. Because if you had a heart attack, what does it mean? If you had a heart attack, it means that your heart muscles will be weak. The pumping action is really ineffective. So it's important naturally, by natural means, to strengthen the heart muscles for the pumping action to be effective once again. If you have had stroke before, it's the same story for you. So do not sit down if you have had stroke before, or mini stroke or heart attack before. And then what you also call the high blood pressure. When your pressure is extremely high for a long time, it puts a lot of pressure on the heart and then on the kidneys. And that with time can cause damage to these organs. It can cause also damage to your arteries, the blood vessels. And if your blood vessel by accident, if it's weak because of inflammatory condition, then holes begin to tear the walls because of high blood pressure and the weak walls of arteries. And then holes begin to form in your arteries. And if holes form, your body will fill in these holes with cholesterol and calcium and other waste in your blood. But it doesn't mean that cholesterol is bad, because 85% of our cholesterol need is provided by our liver. And only 15% comes from food. If you eat healthy, you have healthy cholesterol coming. So natural body substance can't be a disease. Obesity, if you're obese, you have unnatural weight, then of course, remember that it can be an issue. And then the last point here is atrial fibrillation. That is a heart disorder. If you have a heart disease, any form, like atrial fibrillation, then you know that there will be a problem with the vascular dementia. So today it has been really getting empowered through actually knowledge. As the Bible said, my people perish because of lack of knowledge. Don't be actually ignorant, never. And visit us on YouTube. All the presentations are there. Just put in Dr. James -natural link, and you put in the topic you want, and you can listen to any of the presentations, the past ones. And please subscribe so that you will not miss any presentation, because every Thursday, Sunday, we have a brand new topic coming. So don't miss anything.